pharmacies using the Medmate portal. Firstly, log in and then head to your telehealth tab and load the telehealth request. You can see we have the Medmate doctor request form. This form can be used 24/7 for a patient that requires access to a medical practitioner that cannot otherwise access one from within the pharmacy or nearby. We simply choose our referring clinician type, pop in our name as the referring clinician, choose our consult type. These are marked with wholesale prices. It's important to remember to set up stock cards for these consults and add in your portion of the consult fee for your retail price. And then if you have medications that you want to search for, you can add more than one. The doctor will consider these medications when they are consulting the patient. They are, of course, an independent practitioner. They will make their own independent clinical decision based on the consultation they have with their patient, but it is very helpful to give them as much information as you can as to the patient's regular medications, the medications they are requiring, or their presenting complaint. And if we didn't have medications, we simply wanted to send a patient through that was too complicated for a pharmacist to treat in store, for example, a complicated UTI, we could put in our subjective objective assessment plan into the notes to doctor and send them through to the doctor for further consultation and review. It doesn't need to be an essay, but keep your notes to doctor in that SOAP note style to allow the doctor to make a quick assessment of the handover and allow for a thorough and clinically sound consultation. And then we simply complete the form with the rest of the patient's information. Allergies, first name, last name. The email address is very important. It can't be the pharmacy's email address. It needs to be the patient's own, and that is because they will receive all correspondence after the consultation to that email address. That includes post-consultation letters and any referrals or medical certificates. If their email address is not correct in the form, they will not receive that correspondence. Pop in their phone number. It doesn't have to be a mobile number. It doesn't have to be an Australian registered number, but it does need to be a mobile number if the patient is going to receive communications from Medmate leading up to their consultation to their phone. So that will include confirmation that the consultation has been received and notifications about their upcoming consultation with the doctor. If it is a landline or an international number, of course, they will not receive those text messages. Then choose their gender, the date of birth, their address, and include their Medicare card if you have it, if they have one. That means the doctor can quickly identify the patient and also provide an e-script. If they do not have a Medicare card, that is also okay. They will be asked for a form of photo ID prior to the consultation. You can provide that by using the upload a document function, which will speed up the verification process. But if you don't have that on hand, the Medmate reception team will contact the patient once the consult has been received by the clinic to ask for that ID. And then we click agree to the terms of use, the terms and conditions, and the privacy policy. Those can all be accessed using those links if patients do want a copy. And then we place the order. From here, it will sit in pending while the patient's identity is being verified and the patient is moving through the Medmate clinic, where they will be loaded to the next available doctor's waiting list. From there, once they have had their consultation and a script has been provided, if it is an e-script, the consult and the script will sit in script issued, where you can complete the process If the patient does not have a Medicare card, they will be provided with a standard paper script. The copy of that script will be emailed to the pharmacy, and the paper script original will be sent in the post to the pharmacy as soon as it is received from the consulting doctor. Any cancelled consults will sit in cancelled. Reasons for cancellations could include a request for a controlled or monitored medication. Medmate doctors do not prescribe S4Ds or S8s, and they also do not provide any prescriptions for monitored S4s. So those include things like quetiapine, tramadol, Panadine Fort. They will prescribe the full range of S4s, but not any medications that you would find on the monitoring platform. So that includes SafeScript, QScript, TazScript. If you would find a medication on those platforms, then Medmate doctors will not prescribe it. And that is because they do not have an existing relationship with these patients. And then from there, you can provide the dispensed medication to your patient and complete the process. It's very important that you remember to charge the patient for the consultation in the pharmacy. They will not be charged by Medmate for anything. That is up to the pharmacy to make sure that payment is processed. In terms of billing, Medmate will send the pharmacy a bill for any consults that have been requested during the previous fortnight. That will only include the wholesale price of the consultation, and that is it. There is no cost to be connected to the Medmate portal, no subscription fees. It's simply the collaborative consultation, and the invoice will include only the doctor's portion of that consultation.